Hi, this is the webinar for the Psychology Note for Behavioral Care Solutions. I'm going to be taking you through how to log into the system and create a note for your practice in our EMR. As you can see on my screen right now, I am on Google Chrome, which needs to be downloaded to your iPads, or if you're accessing our system through a desktop or a laptop, you need to access it through Internet Explorer or Google Chrome. We are a web-based system, so any time you have access to the internet, you can access it on this web page, www.wrshealth.com. Again, it needs to be accessed through Google Chrome or Internet Explorer. You can pull us up on Safari and Firefox, but we don't function properly, so you need to download Google Chrome to any iPads. You'll go to www.wrshealth.com, and the very first time you're on our webpage, you'll scroll to the bottom and use the option that says Practice Login. But on our page and for Google Chrome, it allows you to bookmark the page, and so you can use that feature right here on our webpage that says to make it your home screen or to bookmark it, or you can also use this feature on Google Chrome. And the top right hand side of the screen, there's a star, and it allows you to use Google Chrome to bookmark a page. So the very first time or anytime you want to access our system, you can do it through wrshealth.com, type in your username and password and log in, or if you bookmark it, it will take you to that screen next time. The next screen you'll see is the location screen once you've logged into our system. This screen is really important because you need to select the location that you want to create your notes for your patients on, so both the note and the claim will be stamped appropriately for your patient visit. So you can see it says Dimondale Nursing Care Center right now. If you click or touch on this box, there is a scroll feature, but there's 300 locations built in. The best functionality is just start typing the first few characters of the location's name, and it will quickly take you to it. And then you can highlight whatever location you want to be in blue, and you'll hit the blue go button. So it's very important here at the location screen, once you've logged in with your username and password, the first screen you will see is location. It's really important that the notes you create for your patients are created in the right location, so the note is stamped properly and the claim form is created properly. So once you hit go, it's going to take you to the welcome screen of our system, which is the messaging module. This is a really great way to check your messages inside Waiting Room Solutions and create messages for your colleagues. It functions a lot like Microsoft Outlook, but just remember this is secure messaging, so this will not message anybody, any of your colleagues' personal emails. This is like intra messaging inside Waiting Room Solutions. So you can use the new feature on the top left side of the screen to create a new message. Like I said, it looks similar to Microsoft Outlook. The green resources button is already selected for you, so if you type in this white box that says select a few characters of your colleague's name, it will show up. You can turn them blue and then type your message. And this is a great way for you guys to collaborate healthcare. Again, the messages will be seen by your colleagues when they log into the system inside the messaging for Waiting Room Solutions. So I do have a one-time setup that I need you to do the very first time you access our system. Up here on the top right-hand side of the screen under Preferences, please click on Preferences, and the bottom option says Theme Settings. If you are using our system on an iPad or a tablet, please make sure you put iPad tablet mode to True and hit Save. But if you're accessing our system with a desktop or a laptop, it's going to be iPad tablet mode false and hit save. So if you happen to switch back and forth between devices, you'll need to adjust this setting right when you log in. So if occasionally you're going to be on an iPad and occasionally on a desktop, please make sure to let our system know which device you're using to access our web-based system. So iPad tablet mode true if you're using an iPad or a tablet, and false for a desktop or a laptop. Hit save. So once you walk into the system, the first thing you're going to want to do is create your list of people that you need to see today. We call this list your recall list. How you access your recall list is the top left of the screen says scheduler. The fifth option says patient recall. You'll need to use 3 pieces of information to pull up your recall list. what date range you want, which will probably usually be today, which location. Even though you're logged into a location, you still need to sort based on the location that you want to find patients for. So typically this would be the location you're in, but it may be that you're looking up your recall list for your next location before you drive to your next location. So you would always want to sort for which location. I'm going to leave it to any for training purposes. And then the third option is appointment type. And this is going to be whatever role you play for the practice. So if you're a social worker, you're going to want to leave it there. NPPA, psychiatrist, or psychologist. So here what you're going to want to do is use the 3 pieces of information today, or the next 7 days or the next month. Maybe you're planning a vacation, want to see how busy you look. So you can use any date filter, location filter, the location that you're trying to create your list for, and then your appointment type. Once you hit submit, you're going to see your list of patients to see. I'm going to keep it focused on the test patients that are located at the bottom of this list because there's a lot of real patient data already in the system. So let's pretend that these are the 3 patients you need to see today. What also may happen after you've created your list of the 3 patients to see is you may be approached by someone at the facility to add on a patient. So if that happens, you have 2 choices how to add that patient onto this recall list for today. You can call your PM and have them added to your recall list for you, but it's really quick for you to add this patient in. The first thing I'm going to want you to do is see if this patient's already in the Waiting Room Solutions database. We've uploaded 10,000 patients from your demographics, and so this might be a patient that was seen a couple years ago that's back to be seen again. So please always look for the patient in this white box that says Quick Patient Search by putting a few characters of the patient's first or last name in and hitting search. It's going to pull up all the patients in our database. So the patient may very well already be in the database and you only need to create the recall. If you can't find the patient in the database, you have 2 options. Call your PM and ask them to put them in the database for you, or add them yourself. To add them yourself, you're going to access the patient screen, which is on the top left of this of my screen, patient registration. You only need 4 pieces of data to quickly put a patient in our system: name, date of birth, social security number, gender. So there are red asterisks next to more fields, but we've programmed the system to accept just 4 pieces of information for quick entry into adding them into our systems database. So name, date of birth, social security number, and gender. Please scroll to the bottom and go ahead and bubble in the signature on file for both the privacy and assignment of benefits, because it won't let you create a note if you haven't, and hit submit. The next screen is going to ask for insurance information. Your PMs will do that for you, so please just bubble in self-pay and save. So the first thing you'll do is create your recall list, and then if there's any add-on patients, please search for them in this test screen above, in the search screen above, and see if they're in the database. If they're not, under patients, patient registration, you can quickly add them with 4 pieces of information: name, date of birth, social security number, and gender. Scroll to the bottom, bubble in signature on file both places, and hit submit. And the next screen will just ask you for insurance. Please hit self-pay and save. Now they're in the system, and throughout this webinar, I'm going to show you how to access the recall list, and you can do it that way. So I'm going to go back to our recall list that we pointed to at the beginning of training, go back to where we started, and I'm going to pretend that I have these 3 patients here to see at the facility today. So how you're going to access creating a note for them is if you're on an iPad, you're going to touch anywhere on this horizontal bar, just not directly over their name because it is a blue hyperlink. Touch on this horizontal bar, or if you're on a desktop or laptop, you'll right-click in the horizontal bar. It will pull up this new box that says create new note and close recall. So this is how you're going to start today's note and close them out of the recall list. So I have one more piece of setup for everybody to do tonight. Once you access the system for the first time, I need you to set your drop-down box for your favorite note types. So you're going to touch this drop-down box right here where it says psychiatry note. The bottom option says customize. Please touch on customize, and in a new tab or window, which is a very big deal for Waiting Room Solutions, basically everything opens up as a new tab or window. Please choose the notes that are on my screen to save to your favorites: blank note, phone message, prescription note, and then psychology note and therapy note, because tonight's webinar is about psychology and the psychology note and the therapy note. So you would not need the psychiatry note, just the psychology note and the therapy note. Also, the second piece of setup in this area is please all the way to the right of the psychology note. Please bubble this in with this radio button all the way across to set your default for the psychology note. So now you've given yourself these note types and then the psychology note. And if you hit save, now this is a one-time setup for the note types in our system to help you create the type of notes you want. And so it would default to psychology note. The other note types available, blank note is a nice note just for you to create any kind of chart entry. Maybe you came to see someone and they were getting another therapy or gone for the day. Then you could just write a little note to save it as an entry. It's just a blank box. We also have a note called phone message. The names of the note aren't important. It's just how you want them to function. I personally put all my phone calls in blank note, but we do have a phone note called phone message. The note you'll use the most is the psychology note, and I'm going to do that in training tonight, and I'll quickly touch on the therapy note as well. It's a very similar note. We can access the psychology note or therapy note. Now that you've customized your drop-down box, you can access either one. So tonight what I'm going to do is take you through the psychology note from start to finish and how to fill in all the boxes and how the features of the system work. The very top box says referring provider. So here you'll free text who the referring provider is if you want that to appear in the note. There's a calendar feature for the referring date. You can use the calendar feature to put the date, the referring date in the note. The chief complaint box has a free text box. You're just going to free text what you want it to say. You also, if you're accessing the system on a tablet or an iPad, you can use voice recognition here and have it text as you speak. The next box is the HPI, the history of present illness. Again, you just put as much or as little data as you want to appear in your note. And so here I'm free texting. The second way to put data here is using the voice recognition on your iPad or tablet. The third way is using an HPI template. I'm going to show you how they function. Not everybody will like using an HPI template. I'm just going to show you in case you do. It is a nice way to put a lot of data into the HPI without doing a lot of typing. The HPI templates are accessed with this drop-down box. We've built in about 6 to your system, the alternate HPI, antipsychotic dose reduction, consent to use psychoactive medication therapy, informed consent to participate in telemedicine, psychopharmacological dose reduction, and sedative and hypnotic dose reduction. So again, they're optional. Some people may never use these, but it is a way to put a lot of data in the note without a lot of typing. You just choose it from the drop-down list, the one you want to use. They look a little bit messy, but the creator of the template put them in a question and answer format, and you can just touch on what you want the answers to be. So the creator of this template asks for onset and duration as reported by, and you have two options, resident or staff. So you just touch on what you want it to say, and it strikes through the other option. The next question is the resident symptoms, and it's either are continuing or gone or better. I'm going to click on gone. And now the other options have the strike through. Context says related to, and I'll say it says health issues, family, recent event. I'm just going to touch on family. And so you'll answer each of the questions that is given to you in the template just by touching on it with your mouse or your stylus or your finger. And then it's really important that you use the blue Save and Edit button. Save and Edit flattens those choices out for the template and adds them as text into your HPI box. So again, templates are optional. They are a nice way to put a lot of data in just by clicking or touching on it and hitting Save and Edit. It's really important you remember that you need to do templates first, then free text after. So once you've employed a template, you can free text, backspace, cut and paste. This is just anything like you use Microsoft Word, but free text after you use a template. Or if you type out a lot of information and you decide you want to use a template, just like with Word, you can highlight it and cut it or copy and paste it, then employ a template and put that data back in. If you want to use two templates inside OneNote, you would need to use this green Add New HPI button over here to the right. It's going to give you a second chief complaint box and a second template. and then you would just employ a second template, click on the answers you want it to say, and then save and edit. So some of these templates have very few questions and they're really fast to employ, but they put a lot of data here. So they can be a nice time saver. So just remember, template first, then free text. Only one template per box. Use the Add New HPI button if you need a second or a third template. The next section here is goals, interventions, and plans. There is data in the right next to each of these, and you can use your mouse or your touch screen to get it what you want it to say. So if you want the answer to the primary goals be increase in interpersonal interactions, you're just going to turn it blue. You can use your control key to make a second one populate your note as well. Don't forget that there's multiple options that you might not be able to see, so you can use your scroll key to see the other options. So again, the control key would allow you to choose as many answers as you wanted to appear in your note. The next one is therapeutic interventions. The box works the exact same way. There's lots of options given to you in the box next to it, so you just click on what you want it to say. Again, if you want more than one answer, use the control key to turn it blue. The third question is the patient's response, motivation, capacity. Again, just touch on what you want it to say and click on control key. Some of these are already grayed out because this patient has already had a note created in the system, so this data is carrying forward. So right now, if you didn't make any changes to this grayed answer already says number of initial continued sessions, but you could add to it or change it. The measure outcomes using, again, you just touch on what you want it to say, use the control key if you want to have more answers, and again, don't forget about the scroll features. We've given you more that might not be in the view. Here we've given you additional comments so you can free text in this box as well. It's really important to know that our system does not have autosave built in, so you are going to need to use the save key. It's located frequently throughout the page. Save will allow you to save your work and stay on the same page. Save and next will take you to the next page of the note. So before you get interrupted or navigate away, or maybe somebody's talking to you and they want you to open up another chart, just remember save, save, save. Save your work before you navigate away. There is not autosave built into the system. So you can use save or save and edit and stay on the same page, or save and next will take you to the next page of the note. These gray tabs here on the left are basically live web pages for the next page of the note. So you can see I'm on the psychology progress page. The next page of the note is the exam page. So if I hit save and next, it's going to take me to the psychology exam page, which is now turned white on your screen. If you're interested in looking at the vital signs, they're at the top of the page. You don't need to enter any, but if you want to, you can. There's free text box here if there is some relevant vital signs that you would like to appear in the note, but for the psychologists and social workers and therapists, it's not required. It's only required for the NPs, PAs, and psychiatrists. They need 3 vital signs. But if you want to look at the history, you can open that box and see what the weight was the last time. If you want to put any vital signs, you can here. Please remember to save your work. There is the ability for you to put the scores in for any of these psychiatry forms, so that may be helpful for your note. But again, this is completely optional. Anything you want to appear in your note, you can. And then save your work and it will collapse the box. You can see when we got to the exam page for ADAM test, there's already data here because somebody else has created a note on ADAM test in our system. So just like there was a few areas on that first page that data carried forward, the data carries forward here as well. So if you're the one that created the note on ADAM test a week ago or a month ago or a year ago, your data is going to carry forward from one note to the next. But it could be one of your colleagues saw this patient and created this note, and this is data from their note. So there is a clear all fields button to make this all this data go away. So if you created it and it's the same, or you just want to add to it, you can leave it here. Each of these text boxes, you can free text, you can dictate with Dragon Medical or voice recognition, and you can also see that when I touch on the box, options opened up that we have given you. So you can put data in these boxes several different ways, by free texting, dictating with voice recognition, or using the boxes we've given you. But you can also use the clear all fields button to start all over from scratch and make this area completely collapse and then be brand new for you to address today. The N button will populate the normal for that person, that user, so then you can free text, you can use the options. Each box in our system is customizable per user. So if you touch on Customize List in a new tab or window, it will give you all the options, but you can add new ones. So here you could add an entry, and this would only appear for your user login. So from the Customize List tab, you can modify the options we've given you, you can delete them, you can move them up and down, you can change what your normal says. So each box in the physical exam is completely customizable per user. So it's really nice for you guys to go here before you start seeing patients with our system, and then you can customize the entries and it makes it sound like you. So remember, you can put data in these boxes 3 different ways in any order you want. You can free text, you can dictate with voice recognition, you can use the options we've programmed for you, and every box is customizable per user. So again, you want to put what you want to appear in your note, any relevant positives or negatives. The one neat thing about our system is anything that you don't want to appear in your note, you just skip it. So if you don't want volume and language to appear in your note, just don't put any data there and those sections won't appear in the note. So really you get to control how much appears in your note just by what boxes you address. Remember, save frequently throughout the page. If you would lose access to your internet and you hadn't saved your work, you would lose your data. Or if you navigate away from this page, either on another website or open up another patient's chart and you haven't saved your work, you'll lose your data. So please make sure you save your work frequently. Save and Next will take you to the next page of the note, which is Assessment and Plan. This page is all about ICD codes and the plan. Again, this is another page of the note that carries forward from one visit to the next. So somebody created these diagnosis codes for Madam Test. Could have been you, could have been one of your colleagues that created a psychology note. So you have a couple choices. If these are the exact codes for the patient, then you can leave them here. If this is your plan, you can leave the plan here or add to it. You can free text, dictate, but if none of these codes are relevant for today, you can get rid of them by checking the box in front of them and using the delete feature to get rid of the codes. This page is how you're going to code your note and code your claim form. So it's important that today's codes here are relevant for what you want to appear in your note and what you want to appear in your claim form. A second way to not use a code in today's note or claim form is over here on the right by unchecking the Include in Note button. So it may be that this patient frequently battles insomnia, but today's note, you don't want to address it. In today's claim form, you don't want to address it. You can leave it here in the list, but uncheck the box here to the right and not include it in today's note, but leave it there for your use sometime later. So totally up to you. You can delete it off today's note and claim form or just uncheck the box, Include in Note. The plan box is for you to free text your plan for this acute stress reaction diagnosis code. So you can keep texting all of your plan here. You can dictate with the voice recognition as well. The D button here is really handy. It stands for Set Default Plan. This is how you can free text a plan for that diagnosis code F43.0 and save that plan as a macro for you for that code for all the patients in the system. So if you type out a really nice paragraph on acute stress reaction and you want to save it, these default plans are per user, per diagnosis code. So it would save that default plan for you for F43.0 on whoever you used it for. And if it follows you to the next patient, you use it, and then you decide, this wasn't as good as I thought, I want to add to it, just add to it, hit the D button again. Every time you hit the D button, it will overwrite the last defaulted plan. So defaulted plans are like little bitty templates or macros built in per user, per diagnosis code. There's also a status box here that's nice if some people want to use this to address different labels for your diagnosis, acute, deteriorated, new, improving. The feature can be helpful as well. Over here underneath the code, you'll see the red I box and a green E box. Both of these are about patient instructions. The red I box are practice loaded instructions for this particular diagnosis. So if you click on it in a new tab or window, it's a practice loaded instruction for adjustment disorder if you want to print it for a patient or family member. The green E button is a Medline handout on that same diagnosis. So now you're off our website and on the Medline library. And again, you can also print this or for a family member or a patient. So the green E and the red I button are different educational materials for your patients. To code today's note, you can code it a few ways. Sometimes there'll be codes carried forward for you, but the easiest way is to code right here from the super bill that we've provided for you, just by checking the boxes and hitting add to current note. So you'll be adding diagnoses and deleting diagnoses based on if this patient has been seen in our system before. You can also add a diagnosis from this area at the bottom of my screen called Users Most Frequent. So as you start using our system, it will save your most frequent diagnosis. You can turn them blue and add them to the note this way. So whichever way is easiest for you, they'll carry forward from one note. You can recode from Users Most Frequent. You can recode from your super bill. You can check the boxes and delete them from today's note, or you can uncheck the box, leave them on the list for maybe use later, but don't include them in today's note or claim form. There is a search feature here in this type ICD problem to search. It's super effective if you already know a little bit about the diagnosis code. There's the 80,000 codes built in here, so if you start typing, it's only going to bring up the ones based on how the coding book has them listed. So it's a little bit easier if you know a little bit about the numeric codes for the ICD-10. Disposition's another nice place on this area where you can free text. But it's also a customizable box. So this is great for follow-up things that you say repetitively, maybe treatment plans, maybe some educational things, anything that you want to customize and save here that you say repetitively over and over, but may not be related to a code like above for a defaulted comment. This is a nice way to quickly retype it for other patients' notes. So this box is customizable per user, just like the physical exam page is. So assessment and plan, all about ICD-10 codes, all about your plan, all about your disposition. Save your page frequently. Save and next will take you to the next page of the note, which is orders and procedures. The first thing you'll probably address is service coding. You'll change this drop-down box to nursing facility visit, and you'll see it's bubbling in the appropriate code for what you want to code today's nursing facility visit code. So you'll bubble in the appropriate code. And to the right, use Save Service Coding. Also, there's a super bill provided for you if there's any CPT codes that you want to bill for. So if you did any kind of CPT codes that aren't above, any psychology, any psychiatry codes, you're just going to check the box in front of the CPT code you want to use. And in Waiting Room Solutions language, anything you're billing for is a procedure. So you'll use the blue Add as Procedure button. Now at the top here, you have a list of all the things that you want to appear in your note and on your claim form. Other CPT codes you might want to order or recommend a test. That is what Waiting Room Solutions would call an order. So not everybody listening to tonight's webinar probably feels comfortable ordering a test as like an official order. So you could just annotate you recommend the patient get a folic acid or a CMP in your plan, but you could just check the CPT box here and hit add as order. And inside the note, it would designate what you're recommending or ordering and what you're billing for. You don't have to use that feature for ordering here. The NPs, PAs, and psychiatrists will. But if you would rather just annotate it in your plan, that's perfectly fine too. It just depends, your preference, how you want it to appear in the note. Again, the Save button will save frequently. Save and Next will take you to the next page of the note. But this page is all about diagnosing your CPT codes for today's note and today's claim form. Accessing the service facility visits from this drop-down box. And typically you're just using the CPT page here that they've provided for you for your common codes. There is a search feature at the top of this screen too. Again, it's really helpful if you know the first few characters of the code, so it will find them. Otherwise, it can be a little cumbersome to use the search feature. Save and next will take you to the final page of the note, which is complexity and coding, which allows you to free text how many minutes you spent with the patient, your start time and end time. And then the final box is the interactive complexity. It's a box that you can free text. You can dictate with voice recognition. We've given you 4 preloaded answers, but this box is completely customizable per user as well. So here, disposition, and every box and review of systems, completely customizable per user. It's real important, again, that you save your work. Now we've gone to every gray tab of the note. If you forgot something and you want to go back to the exam page, just remember you can touch or click on any of these gray tabs to go right back to that page and put any more data in or fix any data. But once you've created your recall list, created your note, now I want you to view your note so you can look at it for accuracy and completeness. This blue View Note button, click on it in a new tab or window. You'll have the note in its viewable form. This will be how it looks if it's printed, faxed, or emailed to anybody, so you can read it for clarity, for completeness. Remember, it's open up in its own tab or window, and so if there's something you forgot, you can go back to the original tab and access the page that the note is in, and you can add any entries to it. So once you've created your note and viewed your note, the final step is to sign your note. So this blue Sign Note button at the bottom here of the View feature, or in Note Creation, the Sign Note here on the bottom left-hand side of the page. So I want you to create your recall list, create your note, view your note, sign your note, and then from the Sign Note feature, the last thing I want you to do is fax or email your note to the appropriate place. Right now, this feature isn't fully finished being built for your practice yet. So if you hit blue fax note now, it's going to look a little different in the next week. It's going to give you a drop-down box of your favorite fax numbers. So you'll just choose where you want it to fax and hit Send Fax. There is going to be a blue email button here as well, so it will be faxable, printable, or emailable, and the email feature will be very similar to the fax. It'll have a drop-down box of email addresses that you'll use frequently, and then you'll just send it from there. So create your recall list, create your note, view your note, sign your note, fax and email your note. Any note that you have started, any patient's work that you have started in our system will appear in the bottom left-hand side of the screen under Recently Viewed Patients. So once you've accessed every part of the system that we've already done today, your recall list, creating your note, viewing your note, signing your note, printing it and emailing it, the next thing I'm going to want you to do is put this patient right back in your recall list so you can see them again. This step is really important because this is how you're going to remember to see them in a week, in a month, or 2 months. So you're going to hover over the patient's name, and you're going to go to the second column, Scheduling, Second Choice, Appointment Recall. And this is already going to be set for this patient's name, and it's already set for a new recall. So you can decide whether it's weeks or months that you want to designate it. If you want to see this patient in 4 weeks, you'll set them up for a recall in 4 weeks, or you could use in the month of. You could write yourself a note here, or not, it's optional. And then you're going to use the appointment type to put them back in your recall, just like whenever we looked at your recall list. So you're going to set Adam Test for his recall in 4 weeks on your schedule. You can write yourself a note here and submit your recall. And now in 4 weeks, Adam Test will show up on your recall list when you come into the facility. It's also a great feature for you guys to set recalls for your colleagues. So if you want to set a second recall for Adam Test for maybe the psychiatrist, you could go ahead and set them in 1 week for the psychiatrist and type a comment here for the psychiatrist. So this is a great, fast way to coordinate the patient's care. So after you create your note, you're going to hover over the patient's name, create the recall, and then you can create them for yourself so you can remember to see this patient in whatever time you designate. But you could create a second recall for the psychiatrist. You could create a third recall for the MPPA. So this is a great way to coordinate your care here. This is the time I'm going to tell you about the current log system is going to go away, and it's going to be replaced by Sign Notes for your payroll. The third tab here is going to allow you to access which notes you've created in our system. So this is how your payroll is going to be calculated. So you can use whatever search filter you want, days, you can do 3 days, 7 days, 30 days, and you can recall and retrieve your charts. This was also where you would see your unsigned charts. So your signed charts are going to be used to calculate payroll. So it's very important you create your notes and sign your notes in 24 hours for CMS guidelines, but your payroll is going to be created here based on signed notes, and so your current log system will go away and be created by be created by signed notes. So if you have any questions about the particulars of that, I'll refer you back to Monica so she can talk to you about how the current log system is going away and being replaced by signed notes. How you can access what you've done in our system is the third tab, EMR, the current charts, decide what filter, recall and retrieve your charts, or use the blue unsigned charts, or you could use today's charts and see what you've accessed. The V button will allow you to view the note. The S button will allow you to access the super bill if that interests you. But if you come here and find, okay, this week I forgot to sign a couple notes, you can use the V button, view the note, and then do exactly what we talked about earlier. You're going to sign your note, then fax or email your note. And this area is going to be very important for you guys for your payroll. It's real important that your PMs have your face sheets. The face sheets will let them know who's going to be at what facility, so it's important for scheduling. So the PMs are going to need the face sheets to in advance so they know where you are. Everybody will have access to this system in your facility so everybody can see the schedule. The last thing I can show you is just briefly a little bit. Here is the therapy note for this patient, again, by just changing the drop down. The therapy progress note is just a shorter note. It has the history of the HPI, the chief complaint, the HPI box, and then the assessment and plan page and the orders and procedures page. So it's a very similar note to what we created for the psychology note. It's just a little bit shorter, has the chief complaint, the HPI, assessment and plan, and orders and procedures. It functions the exact same way. Psychiatry note is just a little bit of a longer note, has a medications page and a past medical history page. So that is all the content for the psychology note. Just make sure you create your recalls. Search for any patients at the top in the search screen and then add them in the patient module. So patient registration, you can add the patients, search for them in the top box to make sure they're not already part of our database, access the scheduler and your recalls when you go into a facility, and access your history of notes you've created or your unsigned and signed notes and EMR current charts. Okay, I hope this information has been helpful. Thank you.